Shingles is a blistering rash that can be very painful that occurs in people who have had chickenpox. What happens is the virus of the chickenpox lives in the nerves, and when people get stressed or have other physical conditions, the virus comes out and initially will create some pain in the area, and then after several days of pain or itching, this blistery rash will come out. When the blisters are there, this patient can give other people who haven't had chickenpox the infection. You can't catch shingles from another person, but if you've never had the chickenpox, this blistery rash can cause the chickenpox. Unfortunately, the real problem of shingles is that you can have pain that can last up to a year afterwards, right at the site, and it can be very disabling. So there's a vaccine, and the vaccine's been around since 2008. It's very effective. It reduces the chances of having the shingles by 50%, and more importantly, it reduces the chances of having that pain afterwards quite dramatically. It's approved for people by the FDA for people over 50. People under 50 can get the vaccine just off-label. If the physician and the patient believe it's good for the patient, then it's okay for them to get that. The Center for Disease Control recommends it for people over 60. They have recommended that everyone over 60 get this vaccine because the chances of getting this painful condition afterwards is so high in people over 60. Unfortunately, some insurances don't pay for it. More and more are, so if you haven't checked with your insurance lately, do so. Part D Medicare pays for it. Some Part Ds do, some Part Ds don't. But this is a very important vaccine, and so it can reduce the chances of shingles and the pain afterwards. People who have immune system problems should avoid it. Patients with HIV, people who are on immune suppressive medications, if they've had chemotherapy lately, they should not have the vaccine. It is a live vaccine. After getting the vaccine, you want to steer clear of people who have weakened immune systems or pregnant women for about 2 weeks. But very important vaccine. Talk with your doctor about whether or not it's appropriate for you. In Texas, you don't need a prescription for it. You can just go down to the pharmacy and the pharmacist can give it to you. In Oklahoma and other states, you do need a prescription. That's a Minute for Health.